Cadillac tax is actually one of the decent policy measures in the law to actually address cost of care, because what was happening is these individuals would have these ridiculously high plans. They called them Cadillac plans because the guy essentially would have to pay zero for pretty much everything. And what would happen is when you don't have to pay for anything, you use it more than you should. And so since they weren't paying for it, people were using their health insurance for things that they didn't really need to. And that was one of the reasons contributing to higher costs. And so they put in a tax where they tax health insurance policies that are above a certain amount. I believe it's around $10,200 for an individual. I think it's around $15,000 or so, maybe $20,000 for a family. But what happens is there's a 40% excise tax on that, and so if it's a $10,000 policy that has a 40% tax, that's obviously going to make it go way up. Well, here's the problem. The cost of health care is growing faster than inflation, and when this tax is set to go in about 2018, there's a good chance that many policies that average Joe six-pack all across the country might end up being $10,000 a year and subject to that tax policy. Very similar to what was called the alternative minimum tax that's in the U.S. tax code that they keep band-aiding each year. And so the Cadillac tax is something to certainly pay attention to. It's one of the main reasons why a lot of employers are looking at defined contribution in private exchanges, because that's going to be a big hit to many of these companies should the tax apply to them in 2018.